Hello everyone, this is Lin Zhong. The topic is RFID application and the system integration in HIS. The content is divided into four parts. The first part is introduction. The main components of an RFID system include the hardware and the software system. RFID tags can be passive or active, depending on powering techniques. Passive tags can only communicate with the readers when they are sitting in an electromagnetic field of the reader since they don't have battery power, where active RFID tags can power the integrated circuits and broadcast the response signal to the reader. An RFID reader scans the tag and sends the tag information to the back-end database system that filters, analyzes, and stores the data and then passes on useful information to another enterprise application systems for further processing. The database system can have multiple readers located in different places sending data through wired or wireless network. There are many RFID applications in healthcare, including tracking, identification, verification, sensing, intervention, alerts, and triggers. Tracking assets and equipment is the most widely used application in hospital. RFID is used to accurately determine the location of victim and staff at the emergency site. Tracking drugs from creation to receptor is applied in the hospital to alleviate drug counterfeiting, theft, and misuse of medications. Misidentification is one of the major sources of medical error, and it can be reduced by RFID. It can also be used for identification of medical articles or patients in hospital. Positive patient identifications application include using a smart patient's wristband that, when scanned by a RFID reader, reveals that patient's information such as name, date of birth, admitting orders, insurance information, and the surgical set. An RFID target can be applied to collecting sensor trapped data and doing computation by extending the chip's interface capability to a sensor. In hospital, temperature sensing makes it very convenient to track tainted blood to aid in protecting a hospital's blood supply. RFID enabled interventions can provide automated care, improve current procedure, get a pathway, enable automatic data capturing and collaboration, and so on. Application involving alerts, and triggers are decided to protect patients from dangerous events or emergencies during the surgery, blood transfusion, drug administration, and hygiene monitoring. The second part is background. Hospitals are currently facing challenges of improving patient safety and reducing operational costs, which are often compromised by human and systemic errors. Meanwhile, achieving high operational efficiency in healthcare is another important goal for organizational performance evaluation. Five problems are identified as the common phenomena that leads to healthcare operation failures, including medical mistakes, increasing costs, safety loss, drug counterfeiting, and inefficient workflow. The third part is challenges. Deploying RFID technology in the healthcare industry for promoting patient safety is a complex issue since it involves technological, economical, social, and managerial factors. The first challenge is technique issue. Technological limitations of RFID can impede its adoption, especially for healthcare. First, RFID may interfere with the hospital environment, for example, medical devices. Second, RFID systems are not always reliable. RFID read accuracy depends on a variety of factors such as tagged object, tag placement, angle of rotation, and read distance. The second challenge is cost. RFID costs include initial hardware and software costs, training costs, as well as the continuously high costs of RFID infrastructure maintenance and upgrade. The infrastructure requires not only tags and readers, but also additional servers, databases, middleware, and applications. Privacy concern is the third challenge. The benefits of using RFID in medical systems are achievable only if patients are confident that the data being transmitted will not be misused. When an RFID tag is associated with a patient, it can contain the unique identification number that associated with any types of personal information. This information is highly mobile and sensitive. Thus, healthcare organizations should ensure neither personal nor confidential information is transmitted via RFID. The fourth part is future recommendation. Firstly, RFID performance in hospitals should be tested to rule out technological defenses. Strategy to these defenses, such as using middleware to improve data quality or using multiple readers to increase data accuracy, should be carried out to improve the system performance. Secondly, the stakeholders should perform a sound and clear renter on investment analysis of RFID project before implementing it. The main issue is comparing the total cost of implementing an RFID system and the total saving by using this system. Thirdly, patients and medical staff should be educated about the RFID technology so they have a better understanding on the benefits and possible privacy issues. Once they realize that RFID can help improve their safety and reduce medical error, they will be more convinced to wear RFID tags and worry less about their privacy. In conclusion, to increase the acceptance and wider use of RFID in healthcare, more customized RFID systems, more institutional support, seamless integration with exciting HIS, satisfactory securing messages, and monitoring regulations to protect privacy and privacy are needed. That's all. Thank you for watching.